So last time we talked about kind of how muscle cells work. Uh-oh. How muscle cells work, and then how just kind of these skeletal muscles in general work. So as far as origins and insertions. Now, whenever you're looking at muscle parts, which end is going to move? The proximal attachment or the distal attachment? The distal attachment. So on our appendicular muscles, we're going to be looking for the distal attachments to move. The opposite of that is going to be true for axial muscles. Axial muscles, we're typically going to see the superior most attachment being the one that's moving. Okay. So that is one of the ways that the body trunk muscles are going to vary from the limbs. But now what we're going to do is we're basically going to kind of walk through some of the major groupings and stuff of the body muscles. I'm not going to spend too much time on this because mostly I want y'all spending time looking at it. Okay. Now, a couple of these, though, are pretty interesting. The first group that we're talking about today is going to be respiration. Now, this just means breathing. Okay. Now, when it says inhalation, this basically means that we're bringing air in. Now, in order to bring air in, we have to make the cavity or the thoracic cavity larger. Okay. So if you think about the fact that we're having to make the thoracic cavity larger, we're going to see muscles on the outside as well as muscles kind of from below pulling out. Anything that allows us to increase the volume of the thoracic cavity is what's going to bring air in. Now, I do want you to kind of pay attention to something, though. Like, just pay attention to the muscles that are moving right now when you're just taking your normal breaths, okay? So take a couple of, like, normal breaths in, normal breaths out, and just kind of pay attention or be mindful of what's moving, okay? You're going to feel two main things. You should feel some muscles on the outside of your ribs, and the primary muscle that you're going to feel is actually down here near your belly, okay? The primary muscle that's going to be doing this is actually your diaphragm. That's this big muscle right here. It's going to be found on the inferior side of your rib cage. Basically is going to track from rib pair 10 up to your thoracic vertebrae of around, I guess that would be thoracic vertebrae like 8 or 10, somewhere right in there. So fairly high, okay? Because remember, those ribs go down. But as this muscle contracts, it pulls down. And by pulling down, you're pulling down. You're making that cavity that much larger. That's going to be the primary muscle that's going to be moving whenever we're breathing, especially during quiet breathing. Now, during quiet breathing, that just kind of normal, us sitting here relaxed and stuff like that. That is also going to be our external intercostals. Okay, so inter means between. So the reason that the roads that go between states are called interstates is because they go between states. Okay, so if you see inter as kind of your prefix, this just simply means between. Okay, now the intercostals are going to be muscles that are in between our ribs. Okay, we have two sets of these. We have some that are on the outside, which are going to pull the ribs out, and then we're going to have some on the inside, which are going to help pull the ribs in. Okay. Now, in normal quiet breathing, it's going to be the external intercostals that are going to be used to elevate the ribs. That's to say, pull the ribs out during our normal breaths, but also during our big breaths. All right, now I want everybody to take a big breath. So take a huge, deep breath in. You'll notice you feel things a little differently, right? You feel your diaphragm pull way down, like you can feel it pushing down into your belly, right? You can also feel your rib cage really opening up, and it also lifts, okay? The thing that's helping it lift is actually going to be this little guy up here. These are your scalene muscles. These are going to help pull up on your rib cage during forced inhalation. So that's going to play a big role. And we also are going to feel some tension kind of on the outsides of our chest a little bit here. And that's actually going to be our pectoralis minor muscles. Which are going to be doing the same thing. They're going to be kind of grabbing onto the outside of your ribs and helping us elevate our ribs even more, okay? Once again, that's during forced inhalation. Now, forced inhalation is usually going to occur because of exercise. Whenever we need to get more air in to feed more air into the muscles, that's when we're going to be getting or doing the kind of forced inhalation. Now, I want everybody to take a big, deep breath out. So not just your normal exhale, but really push. You're going to notice something. It feels like your stomach has to get tight. Your stomach is getting tight because you're helping that diaphragm push up. But as the diaphragm is pushing up here into your chest cavity, that's also kind of relieving some of the pressure down here. So those organs are kind of going up. Okay. Now, we're also feeling like our rib cage is contracting at this point. Well, if those are external intercostals that were allowing us to elevate our ribs, our internal intercostals are going to do the opposite. They're going to pull our ribs in to help us close off that chest cavity, making that chest cavity smaller. That way we can push out more air. Okay. During normal quiet breathing, you'll notice something though. Do you feel like any muscles are really actually doing anything during a normal quiet breath in? Normal quiet breath in, you can feel some muscles acting on the outside of your ribs, and you can feel your muscles in your diaphragm moving. But on a normal breath out, do you feel any muscles contracting? Like any tension? No. During a normal quiet breath out, you don't have to worry about that. You don't have muscles that are contracting to help us push out air on a normal breath. Instead, all we're going to do is allow the external intercostals and the diaphragm to relax. Just those muscles relaxing and kind of bouncing back, because muscles are elastic, allowing those muscles to kind of bounce back to their original shape, that is going to change the size of our thoracic cavity enough to push the air out. Okay. So here's an underview of our diaphragm. So we can see openings for blood vessels, namely our vena cava here. And we can also see an opening for our esophagus here because our stomach is below the diaphragm. All right. Now we can get into the muscles of the abdominal wall. Now we've already talked a little bit about the rectus abdominis. We've used it as naming examples, but we also have a great naming example in the transverse abdominis. Okay, so anytime we are looking for a muscle, the very first thing that we need to look at is the name. What can we learn from the name? We could learn location. We could learn its function. So we can learn the action. We can learn some sort of important identifying information from there. And in many cases, we can learn a lot. Okay, so that's the very first question you need to be asking yourselves, like, okay, what is its name? And then what information can I get out of the name? Because oftentimes there will be multiple pieces of information here. Okay, so for example, transverse abdominis. Okay, we're getting two huge pieces of information here. First is location. We have a body region. So what is the body region that we're going to find this muscle in? In the abdominal region, right? So that means we are now between here and here. Okay. Now, our next piece of information is transverse. What does transverse mean? Exactly, across, side to side. So we're going to be looking for a muscle that goes side to side. Well, is it this one? Is this one going side to side? Are these fibers going side to side? Nope. What about these? Nope. What about this one? Yep. Dang, that's convenient. Okay. All of a sudden, just based off the name, now we can find it. So look at your name first. This is step 1, and really step 2, 3, and 4 is looking at the name and figuring out what you can learn. And only once you've done that, then see if you can find it. Okay. Figure out the name first. Break it down as far as you possibly can. Now, the muscles of our abdominal wall are important though, because these are going to help us compress and hold everything in that abdominal region in place. Okay, we want to make sure the intestines are staying where they are, that everything is nice and protected. We also will use these muscles in many cases to help us do force expiration. So like when you pushed all your air out really hard, you'll notice that all of your abdominal muscles tended to contract and help you kind of push down on your, like bend your spinal column anteriorly. Why? So flexing your vertebral column. Why? So that you can push with more force against that cavity, making that cavity even smaller. Okay. Now, this is actually exactly what a hernia is. So a hernia is basically going to be where you have a tear in that abdominal wall. In many cases, little bits of intestine and stuff like that can poke through that wall and get trapped on the outside. Okay. That could be a problem. This can also happen in males with their spermatic cords, and all kinds of fun stuff, which can lead to lots and lots of problems. Now, here we have some more muscles that are helping hold everything in place. These are the muscles of the pelvic floor. Okay. You don't need to identify any of these. Like, I don't think any of these are on our list, but we can see lots of muscles down here acting on the pelvic floor. Once again, helping hold everything that's down here. So things like intestines, reproductive organs, and things like that, helping make sure that they are held in place and that they're not trying to fall out through the distal end of the pelvic cavity, or the superficial end of the pelvic cavity, or inferior end. There we go. All right, now we get into the muscles of the upper arm. Okay, so now we're looking at the shoulder joint. Now we have our deltoid muscle here. Notice that we're wrapping all the way around our clavicle, and it will even wrap around onto the spine of the scapula a little bit. So we get this big kind of wraparound structure here where it's very, very wide at the top, but we have one insertion point. So we have this big fan-shaped muscle that's going to help us, or primarily help us in abducting our arm, but it will also help us do things like flexing our arm at the shoulder, extending our arm at the shoulder, depending on which parts of the muscle are doing it. We also have a huge muscle right here in the front of our chest. Now, people call these our pecs, and that is correct. However, we have multiple muscles. We have pectoralis here and pectoralis here. Which of these is bigger? Well, this one. So this one is going to be our pectoralis major. Major because it's the larger of the two sets of muscles, okay? You'll also notice that the pectoralis major is connected to the sternum, and the pectoralis minor is connected to the ribs. This is why the pectoralis minor is the one that's actually doing stuff under forced inhalation, is because it can actually move the rib cage, whereas the pectoralis major does not. The pectoralis major is simply going to move the humerus. Okay, now we can also see our biceps brachii here. We have some fun muscles over here, including the muscles of our rotator cuff. So we can see things like our subscapularis and stuff from the front. But we can really see them once we look back here. Now, remember, what's this big structure on the scapula called? Anyone remember? Online people, y'all are welcome to say it as well. Note to self, all of these 6 people that are in here right now, if they wrote this answer down and it was not correct, or it was correct, it is now wrong on those exams. Good to know. What is it? All right, we can do some context clues here. The muscle that is above it is called the supraspinatus. The muscle that is below it is called the infraspinatus. Supra meaning above, infra meaning below. That means this thing is likely called the spine. So supra meaning above, above what? The spine. Infra, so below, below what? The spine. Okay, now the supraspinatus, infraspinatus, teres major and teres minor. Sorry, teres major and teres minor, I pointed the wrong ones. These are your rotator cuff. If you've ever heard someone saying that they have a torn rotator cuff, they are talking about a problem in one of these 4 muscles and the associated tendons with them. Okay? Yes, good, Natalia, it is the spine. Now, we can also see this big kite-shaped muscle right here. This is our trapezius. You'll notice that the trapezius not only is this kind of fan-shaped muscle, but also that the direction of the muscle fibers is going to tend to change. Okay, we have the muscles mostly being flat right here up until we get towards the middle of the neck, at which point they become much more vertical. Okay, so that means these muscle fibers are going to be involved in lots of different things. Like, a lot of people try and exercise their trapezius muscles by simply shrugging their shoulders up. That's not super efficient, since look at all of the muscle fibers that go up and down. It's only these, which means if you wanted to train your trapezius, that is not the most effective way of doing that. Or at the very least, you have to get the muscle fibers moving up and down before you try and do that particular motion to be more effective. Okay. Instead, these are all pulling the scapula towards the spine. So muscles that, or movements that allow you to pull your shoulder blades back are going to be much more responsible for training this particular big muscle here. Okay. Now here we have the latissimus dorsi. So notice that it's kind of inferior to our trapezius, but it's this big fan shape down here, and it's going to be coming up here onto the humerus. So this one's going to be responsible for helping us pull our humerus down. Okay. So if you've ever looked at somebody like a climber or something like that, they will always have overdeveloped latissimus dorsi muscles because that's going to be the primary thing that's going to allow them to adduct their shoulder joint. So adducting their arms back down. That's where they're going to be getting a lot of that strength from. Now, your shoulder blades are going to be very important here, and they can roll around and move and things like that. So different muscles are going to cause different kinds of movements in those shoulder blades. Like I said before, our trapezius is going to be important for allowing us to retract our shoulder blades, that's to say pulling them closer to the spine, whereas moving them anteriorly is going to be things like our serratus anterior and then our pectoralis minor. That's going to help us kind of bring that forward, which is going to be important whenever we're doing something like, say, throwing a ball. Now, we can also elevate, depress, and rotate our scapula as well. Notice that our trapezius is also here in rotation of the scapula. Okay, so all of these are going to be motions that our scapula is going to be undergoing during various arm movements. And controlling our scapula during those arm movements is going to be an important part in doing movements powerfully, while also at the same time doing them in such a way that we do not injure any of the muscles or the connective tissues associated with them. Okay, so your shoulder blades and kind of movement of your scapula and mindfulness of the muscles that are doing that kind of stuff is going to be very, very, very important to your shoulder health, especially if you are doing things weighted. Now, here we have, like I said, the muscles of the rotator cuff. Now, if any of you have ever done a sport where you throw things, you were taught fairly early on how to throw something in a very particular way. The reason that you are taught the mechanics of throwing in a very particular way is to protect these muscles. Each of these muscles is going to do a particular job during a normal throwing motion, which, by the way, is able to generate more velocity than throwing something underhand, while also at the same time being 1,000 times worse for every single part on your body for you. Okay. Yes, a softball pitcher can only throw like underarm and will typically throw in like the 60s, maybe low 70s if they're incredibly good. However, they could do that every single day. You can't do that with this particular motion because of all of the stresses that it's placing, not just in your shoulder, but in your elbow. But proper mechanics can actually help that a little bit. But you'll notice that everybody that does this for any sort of period of time, or like I said, the way you're taught, you're going to be taught this same set of movements. You have to pull your shoulder blade down, or you pull the ball down first. This is basically going to allow you to generate some stretch in your pectoralis major muscle, generating a little bit more power, but also at the same time, allowing you to get the scapula in a correct position for the rest of the motion to be able to bring the arm forward. Okay. Whenever you come up with the ball, so after you're down here and you go to come up, that's going to be your supraspinatus. And you don't believe me? You can actually pull your arm back and do this, and you can feel the muscle on top of your scapula actually working. Okay, you can actually feel some tension there. Just simply elevating the arm to start bringing the arm up, and then now you can allow your chest and your shoulder to bring the arm forward with power without having to put too much strain on these joints. Then you have to do something else that's also very, very important, and that is you have to slow the arm down. Okay, you slow the arm down during the follow through. So after the ball is released, you have to slow the arm down so that it doesn't try and dislocate itself, because it will. You can generate enough speed through your hands that it will generate a lot of force pulling itself away from your body. So we have to slow things down. The way we're going to slow things down is actually with our infraspinatus here and our teres minor down here. Okay, these two are going to help slow the arm back down at the end of the pitch. But without proper extension here and proper extension here, so using the subscapularis to pull it down and the supraspinatus to pull it up, you're not going to be able to generate as much power through your chest muscles and your shoulder muscles when you're actually going to rotate your arm through. All right. Now, muscles that move the elbow joints. So we've already talked about the biceps brachii a little bit. Biceps, we have two heads connecting down to the radial tuberosity down here on the ulna. We also have our brachialis, which is going to originate on the distal half of the humerus and then insert itself down here on the ulna. Then on the other side, we have the triceps brachii. 1, 2, and 3 heads on the triceps brachii, and they will all insert themselves right down here onto the olecranon of the ulnus. They're going to be used primarily to extend the elbow joint and do so powerfully. However, because they all have different origin points, they can actually all be trained slightly differently than one another. Now, these are the fun ones. This is probably my favorite muscle in the arm, and it's called the pronator teres. Pronator. Anyone want to guess what it does? Perfect. It pronates our hand. Okay. Now, because of this, in order to allow that motion, well, that is a rotation motion, right? That means we have to have the insertion point be, or have the muscle itself kind of be wrapped around the bone. Okay. A little bit like a ribbon. So that's exactly what's happening here. When we have our hand supine, so with our hand laying on its back, our pronator teres is right here and it is stretched, and our insertion point is back here on the posterior side of the radius. Okay. Now, when we go to pronate our hand, instead, now that we are inserting over here, we're wrapping around the front of the bone. Now, when that muscle shortens, it's going to pull the back side of the radius towards the anterior surface. So it's going to force that radius to spin around. So we're going to see now that the muscle will be straight when our hand is pronated, and then the supinator is basically now in the opposite orientation. Okay, so we're going to have the pronator on our kind of thumb side, and we're going to have the supinator on our pinky side. But they're basically going to do the same thing. We also have another pronator down here towards the distal end to help with the distal end of the radius doing its job. Now, importantly, with the muscles of the arms and the legs, we've already talked about the differences in motions, right? We have flexion, which is our anterior movement, and then extension, which is the posterior. This also means that the muscles that are on this anterior side in this anterior compartment, whenever these muscles shorten, they are going to cause flexion, okay? So if we're looking for a muscle that says flexor in its name or something like that, we know that we're going to be looking on the anterior surface of the arm. If it says extensor, it's going to be found on the posterior side of the arm. Okay, so we're looking right here. We have brachioradialis. We have palmaris longus pointing towards the palm. We know that our palm is on the anterior side. Flexor, flexor, flexor. These are all examples of muscles. So flexor carpi radialis, flexor carpi ulnaris, common flexor muscles. Okay, or common, sorry, flexor tendon. All of these are going to be found on this anterior side. Okay, now one fun thing is that all of these flexor muscles are particularly ones that are dealing with the hand, so things that are dealing like with the palm. So flexing of the palm, flexing of the digits. We'll go a deep view so you can see another couple flexors. So flexor digitorum superficialis, flexor digitorum profundus. All of these muscles, you'll notice if you track them down, go through the same spot. We have tendon, 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 and they're all going to our hands and our fingers. How do we get all of those tendons and stuff down there without them getting impinged by muscles and nerves and all that other kind of stuff? Knowing also that we have nerves running parallel to these, that we've got blood vessels that have to be running down into our hands as well. This means that we have to have a little groove, like a little tunnel that these things can pass through. If you've ever heard of someone having carpal tunnel issues, it is specifically issues with this little tunnel, okay? We have this fun little bit right here called the fiber retinaculum. Look, see how it looks like a wristband? This wristband of connective tissue is basically there to make a little tunnel. So here we have our fiber retinaculum. where then we can take all of these tendons and blood vessels and run them underneath it. Before we get to the bones. This way we're not getting those tendons and stuff impinged by the bones or being impinged by the other tendons and things like that that are around them. It's basically because we have to have this little tunnel right here. However, years and years of use and abuse of your body and stuff like that, not stretching correctly and things like that, can make this retinaculum fall. Where now it's basically touching them, and sometimes it falls completely. And now we do not have space for all those tendons. So when those things go to move, all of a sudden they're going to be fighting for space. They're going to be bumping against one another, and that's going to start to cause pain and issues like that. And at that point, that's when you go in and you have carpal tunnel surgery, and they basically will go in and put a new tunnel in there for you. One made out of plastic or metal or whatever it may be. All right. Now, we also have a lot of muscles in our hands. These are going to allow us to kind of flex digits and things like that. Your kind of really, really finite control over digital movement is going to come from these little guys down here, but not like lifting power or anything like that. They'll be able to do that some, but most of that is going to be from your larger muscles in your forearm. However, these will do that to some degree, just not the extent that the larger muscles of the forearm can. And we have some deep muscles as well, and some on the back. But once again, you don't have to know any of the individual muscles of the hands or anything like that, because once again, I'm not mean. All right, now, muscles of the leg are going to work pretty similarly to the muscles of the arm, except we have much larger motor units and much larger muscles in general, because these are carrying weight, okay? Now, here we, of course, have our gluteal muscles because we are in the gluteal region. So we have the gluteus maximus because it's the biggest one. Then we have the gluteus medius up here. Now, once again, in cats, these are actually the same size and are actually a little bit more difficult to tell apart. We also have this muscle here, which is our tensor fasciae latae. This one's going to be important for helping us abduct at our waist. Okay, so hip abductors, we have one of those here in our tensor fasciae latae. Now here we have some of the vastus muscles. So these are this is one of the quadriceps muscles. We can also see another one right here in our rectus femoris. We can see a few more of them once we get into a true anterior view. So quadriceps femoris tells us that we have 4 muscles in the leg, kind of in that femoral region. Our 4 muscles are the rectus femoris, the vastus lateralis, the vastus medialis, and the vastus intermedius, which is deep to the rectus femoris. Those will all insert together at the patella, and then they will also all become one with the patellar ligament down here, which will go down and insert themselves on the tibial tuberosity. So those muscles will do 2 things. They will allow us to extend the knee because they're going to span that joint. They're on the front of the knee. They go down here and insert themselves on the distal end of the knee at our tibial tuberosity. So we can extend at the knee joint, but they will also flex our hip, okay? So flexing our hip, that's to say bringing our leg forward powerfully, will be taken care of by our quadriceps femoris. Now we can also see one of my favorite muscles right here. Notice that we have an origin up here on the anterior portion of the iliac spine, or iliac crest rather. And then we're going to insert on the medial side of the tibia. Actually, even somewhat posterior. So medial and posterior side of the tibia, which means we are spanning our hip joint. So when this muscle shortens, it is going to cause some amount of hip flexion. So we're going to pull the leg forward. It's also because it's wrapping around. So notice that we kind of have this C shape. We're starting at the front over here and inserting at the back down here. So we have a wrap around, which means we're going to cause some rotation. We're going to cause lateral rotation at the hip. And it will also cause some flexion at the knee because we're inserting on the back of the tibia. So it's also going to cause flexion at the knee. Your ability to sit with crossed legs is from this muscle. This is called the sartorius. Sartorius means the tailor's muscle. So if you've ever had pants or anything like that tailored, or a dress tailored or something like that, you'll notice that the person that is doing the pinning will usually sit down with their legs crossed because they're having to get low. So they'll sit down as they're doing that. So that's why they call this the tailor's muscles, because it was very common for people to sit with their legs crossed while they were doing all those pins and stuff like that. We also have this muscle right here. This is a fun one. This is called the gracilis. Gracilis, because this one's actually going to bring your legs back in. So we had our tensor fasciae latae here, which is our hip abductor. Our hip adductor is going to be our gracilis. Now, there are others. This is just kind of the biggest one. We have another one, which is adductor longus and all that fun stuff. So we have some in here. Now, when we look at the back, we have what are known as the hamstrings. The hamstrings are 3 muscles. Looks like 4, but it's 3. We have the semimembranosus, the semitendinosus, and then we have the biceps femoris. This is the reason that you cannot just say biceps. If I put a pointer right here, you say biceps. It is wrong because we have 2 biceps muscles, and I don't know which one you are referring. Okay. So we have the biceps femoris down here. So we have another muscle. In this case, it's in the femoral region with 2 heads. Okay. So we have the biceps femoris, and then we have our semimembranosus and our semitendinosus. The way we're going to tell these 2 apart, because I can tell, like, just looking at your face, like, how can you even see that? Easiest way to tell them apart is going to be that the membranosus is more medial. Semimembranosus has more M's and is more medial. Semitendinosus has a T, and T stands for top. So the semitendinosus will sit on top of the semimembranosus and thus be more superficial, but it sits on top of it. T for top, T for tendinosus. Membranosus has more M's and is more medial. Okay, that's the easiest way that I've learned to be able to tell those apart. Now, once we get to the lower legs, we can see some of the same types of deals, where we have this muscle here sitting on the front of our tibia, so it is going to be conveniently titled the tibialis anterior. You better hope I pointed that one, because that's one of the easiest muscles on the body. We also have our fibularis longus, fibularis brevis, things like that. We have the extensor hallucis longus. What do you think that's going to do? Extend. What's the hallux? That's our big toe, right? So that one's going to be responsible for extending our toes. We also have an extensor digitorum in our legs. Oh, now we can see it from the back a little bit better. Here we have our gastrocnemius and our soleus. The gastrocnemius is going to be a powerful plantar flexor. It's going to insert itself on the heel. Okay, so on the calcaneus. So when this muscle shortens, it's going to, well, pull the heel up, which in turn is going to point your toes down. And it's going to do so powerfully. Okay, so the gastrocnemius is primarily used in kind of fast twitch stuff. So when we need to jump or something like that, a lot of that final force is going to be coming from the gastrocnemius. If instead of walking or playing basketball or something like that, you are just, or instead of jumping or playing basketball, you're just taking a 5-mile hike. Instead, it won't be your gastrocnemius that is doing the bulk of that work. It will instead be the soleus. The soleus is right here. This one's going to do more of that sort of slow twitch, high oxidative kind of stuff. That's why whenever you get sore from walking those really, really long distances for the first time in a while, it's because that muscle is undertrained, and that's going to be more like your walking muscle. But that's also why, like, you feel pain in your calf, but it doesn't seem like you can ever actually like massage the pain out. And that's simply because you can't get enough pressure on it because the gastrocnemius is in the way. Ask me how I know this, because I have experienced these pains. They're no fun. Here's our gastrocnemius, so you can see both heads here. Here's a nice little blurb about shin splints if you've ever had these and want to talk massive amounts of trash and how awful this is. There it is. Shin splints are terrible. Now, in the feet, we once again have a whole bunch of intrinsic muscles in the feet for the same types of reasons we have intrinsic muscles in the hand, except once again, these are holding our weight. Okay, because these are having to hold our weight, these tend to have to be quite strong. These are also trying to maintain those arches that we talked about in the bones. Okay, like how we have those 3 main arches in the feet. These are the muscles in the feet are trying to help us maintain those arches to, one, keep us pain-free while also helping make sure that we can mechanically be stable. All right, so those are the muscles. Got through that relatively quickly. All right, so now it's time to just learn this stuff. We've got torso models, we have arm and leg models here and there. Now it's just time to spend some time with it. Online people, y'all have any questions for me?